She suddenly wondered if she was pregnant, but Romans had no plastic pregnancy tests. Her body gave the first clues. Missed periods could raise immediate suspicion. Women often discussed these changes together. Pregnancy knowledge was partly practical and observational. Roman medical writers recorded signs carefully. Soranus later described several signs of conception, but certainty remained difficult without modern medicine, so the mystery had only begun. Roman medicine looked for physical clues first. Nausea could suggest pregnancy had begun. Changes in appetite also attracted attention. The breast could become noticeably different. Menstruation stopping was another important clue. Doctors observed the woman's overall condition. They compared symptoms instead of using machines. Soranus wrote extensively about conception signs, yet diagnosis remained far from certain. Ancient medicine depended heavily upon observation. Then Roman medicine produced something extraordinary. His name was Soranus of Ephesus. He wrote extensively about women's health. His work focused heavily upon childbirth. He described pregnancy care in remarkable detail. He also discussed difficult labor situations. His instructions were practical, not purely mystical. Midwives became central to his medical system. He even discussed how newborns should be assessed. This changed the story of Roman pregnancy. Roman women were not left entirely alone. Experienced midwives could become essential caregivers. The Roman term was obstetrix. Midwives handled much of childbirth directly. Soranus demanded skill and calmness. He valued literacy and medical knowledge. Clean hands and short nails mattered. Compassion was considered part of competence. Several women could assist during labor. Childbirth was primarily a women's space. Pregnancy required careful daily management. Soranus recommended appropriate physical activity. Too much exertion could become dangerous. Too little movement was also undesirable. Food and appetite received medical attention. Morning sickness was recognized and discussed. The pregnant body needed constant observation. Late pregnancy brought additional physical strain. Broad linen bands could support the abdomen. Pregnancy was treated as an active condition. Romans also tried controlling when pregnancy happened. Family size mattered to Roman households. Soranus discussed several contraceptive approaches. Some methods involved oils and plant substances. Others used inserted preparations called pessaries. Some recipes were medically questionable. Others could seriously harm the body. Soranus criticized dangerous methods and superstition. Pregnancy prevention existed long before modern contraception, but reliability remained deeply uncertain. Eventually, suspicion became impossible to ignore. Her abdomen began changing visibly. Clothing needed more room and support. Movement gradually became more difficult. The household could now see pregnancy. The midwife continued monitoring her condition. Rest became increasingly important near delivery. Pregnancy changed everyday Roman routines. Yet the greatest danger remained ahead. Childbirth could still turn deadly quickly. Romans measured pregnancy through months and cycles. Soranus discussed pregnancy approaching its expected end. The timing of birth mattered greatly. Too early could mean serious weakness. Too late could also create concern. Midwives watched for signs of labor. They relied upon experience and observation. There was no ultrasound confirming the date. Every approaching day carried uncertainty. Then the first labor pains arrived. Then the household suddenly became a birth room. The midwife took control immediately. Warm water and clean cloths appeared. Oil was prepared for procedure. Wool and bandages waited nearby. The birth stool became the centerpiece. Female helpers stayed close beside her. The room needed calm, not panic. Soranus emphasized preparation before delivery, because labor could become dangerous without warning. Roman childbirth could involve a special stool. Soranus described its design carefully. The opening supported practical delivery positioning. The woman could remain supported during contractions. Midwives stayed physically close throughout labor. Helpers helped stabilize her body. The goal was controlled, careful assistance. This was practical Roman medical knowledge. Religion still surrounded childbirth emotionally, but skilled midwifery mattered enormously too. Not every Roman birth followed the plan. Sometimes labor became dangerously prolonged. The baby's position could create problems. A poorly positioned fetus was dangerous. Experienced practitioners recognized difficult situations. Soranus described techniques for complicated births. Turning the fetus could sometimes help, but these procedures carried serious risks. There was no modern emergency surgery waiting. A difficult birth could become fatal. Finally, the baby entered the world. The midwife received the newborn carefully. The baby's first cry mattered enormously. Breathing and movement were closely observed. The body was checked for abnormalities. Soranus gave surprisingly detailed newborn criteria. A vigorous cry suggested healthy breathing. Movement and sensitivity were also examined. The newborn's condition suddenly became everything. But the Roman story continued beyond birth. Roman medicine did not stop at delivery. The newborn received a physical assessment. Soranus listed signs of a viable infant. The baby should cry vigorously after birth. Its limbs should move normally. Its senses should respond appropriately. Its body should appear properly formed. These observations resemble later medical assessments. But survival was never guaranteed. The first hours remained frighteningly uncertain. After birth came another difficult challenge. The newborn needed nourishment immediately. Many mothers breastfed their own children. Wealthier families sometimes employed wet nurses. Wet nursing could become a profession. Soranus even discussed infant feeding practices. Breastfeeding could influence birth spacing naturally. But infant survival remained uncertain. Some newborns did not survive infancy. Roman families knew this painful reality. So what happened when Romans became pregnant? They watched the body for clues. They relied heavily upon experienced midwives. Roman doctors recorded pregnancy knowledge carefully. Soranus brought practical obstetrics into Rome. Birth stools and careful preparation improved care. Newborns were assessed immediately after delivery. Yet childbirth still carried terrifying risks. Medicine could observe more than it could fix. And that is Roman pregnancy's real story.